Good morning, everyone. Thank you so much for joining us today. I just want to apologise for the slight delay we've had this morning. We had some technical issues getting the event started and getting the links and things sent out. So thank you for bearing with us while we went through that. I'm just going to quickly go through some housekeeping before we get underway. I won't keep you too long because, as I say, we've already been delayed. But the first thing is it's fairly obvious that you can see us, but we can't see you, so that's great for you. You can just sit back, relax and enjoy. If you do want to engage with us, there is a Q&A function that you can use to do this. This should be located in the top right of your screen. There is a little question mark icon with 2 speech bubbles, so if you have any questions, you can pop them in there, and I have a small army of people helping support this event to get back to you. The Q&A does become very busy sometimes. There are definitely more of you than there are of us here. So if at any point the Q&A is getting a bit much for us, I will just temporarily close it just so we can catch up on your questions, and then I'll open it again. So if it does go away, don't worry, it will come back. And finally, I just want to let you know that there is a sort of 30-second delay between us broadcasting and you receiving it on your screen. So if at any point you the audio goes or the PowerPoint goes or just something doesn't look right, just leave the event and rejoin, and we find that tends to fix it. So without further ado, I'm going to pass over to Fiona, who will give an introduction to dentistry. Over to you, Fiona.
Thank you, and I would just like to welcome you all to the open day for dentistry and for oral health sciences at Dundee this morning. So what we're going to do is just break the morning down into some different sections, and we've got a variety of speakers who will be speaking to you on all these different topics. So first of all, we have Dr. Andrew Mason, who is a clinical senior lecturer in the dental school, and he will talk about the 4D curriculum. And this is the new curriculum that is now in its 3rd year of running, and he'll tell you all about that. We'll have a short break after that, just for 5 minutes, and then I will talk to you about the application process. I'm the lead for admissions in the dental school, so I'll just talk you through the whole process for doing that. Then we have Maxine Lee, who is the lead for the oral health science course at Dundee. That is the other clinical undergraduate course that we run. And that's well worth listening to because quite a number of you might want to consider that as an option, as an alternative to applying to dentistry. After Maxine has spoken, we'll have another short comfort break, and then we have one of our dental students, Gigi, who's actually the president of the Dental Students Society, and she's going to talk about life as a dental student. And that will be followed by a virtual campus tour. So as Amy said, there's a whole squad of people to answer questions. Andrew and I will be able to answer questions about the course and about the application process, as well as a number of people from the admissions team. Maxine will be able to answer questions on oral health sciences specifically. And Gigi, if you've got any questions about, what it's like as a dental student, if Gigi hasn't covered that in her presentation, then feel free to drop a question into the Q&A and she will respond to that. So I hope you enjoy this morning, and I will now just pass over to Andrew and he will talk about the curriculum. Thank you.
Slides, can you see them?
Yeah, I can see your slides. There we go.
Okay. So my name's Andrew Mason. Kind of lost my voice a bit, so hopefully you can hear what I'm going to say. As Fiona said, I'm a senior lecturer here. I'm also a senior advisor of studies. I'm also a graduate of here, and I graduated from here back in 1990. I've had a strong link with the school and been back in the teaching staff since 1995. So I can speak as a member of staff, but also I was in your shoes many years ago. So what I'm going to do is talk about Dundee, welcome to Dundee. Dundee is a place that I think is an awesome place to study. Not only study dentistry, but to be a student in. And obviously, normally we'd be here in person. You could see the city on what is, well, it's not quite a blue sky day, but it's a warm day today in Dundee. So normally we'd be able to show you the city, but we can't. So we'll talk a bit about that first of all. Then we'll talk a little bit about what dentistry is, and then talk about the curriculum, which is down as the new curriculum. And I guess it is new, but it started in 2018, and you'll be arriving in 2022. So it'll be very much an established program by then. So that's what we'll do, and we'll talk about things as we go on. So Dundee, if you don't know Dundee, this is Dundee viewed from Fife, up in the air from Fife. So Dundee is famous for its bridges and its river, the River Tay, which here is about 1.5 miles wide. It actually gets wider as you go inland. This is the Tay Railway Bridge that links Dundee with Fife and on to Edinburgh. And you can see it's a small city, it's a compact city, and the university is situated very much close to the centre of the town, which makes it a great base for student life. So the dental school is this tower building that you can see here, which is where I'm speaking from just now. If we look west, so that's looking north. If we look west, we can see towards Perth and would be towards the sort of Highlands essentially. And you can see how the river widens out, and we see our second bridge, which is the Tay Railway Bridge, which is very famous. It's a very long bridge, and it was famous for falling down about 150 years ago. This is the rebuilt one, and it thankfully still is standing. But you can see really what I think is key about Dundee, which is a city that is surrounded by wonderful green countryside and sea. If we were to look east, you would be looking straight out to sea. So Dundee is an awesome place. It's half an hour's walk across the bridge to get into the countryside, and that's quite unique for a city, I think. This is a view of the railway bridge, looking across towards Dundee. You can see part of its sort of industrial heritage of the old mills and the tenements, which are still there in some parts and often converted into flats nowadays. And this picture of a train is not because I'm a train spotter. It reminds me of the fact that Dundee is well connected. This is a train that goes to London, and there is 3 London trains a day direct from Dundee. And Dundee is well connected to Edinburgh, Aberdeen, Glasgow, Inverness. So what Dundee doesn't have is there's a good rail network or bus network that links Dundee to other places nearby in Scotland, or even if you want to go further afield, you can head down the east coast to London and be there in a matter of hours in a comfortable train. So Dundee's it's not really a well-positioned city, it's a really well-connected city. And it's a city that's really on the increase. This is the the reflections of Dundee's sort of newest landmark, which is the V&A Museum of Design, which is present down at the waterfront in Dundee. And this has brought crowds of people to Dundee, people interested in design, interested in the arts, and interested actually in architecture as well, because the building is really quite a stunning building. So Dundee is a city that's changed a lot in the times that since I came as a student, and it's going to change again in the time that you would be a student here. For example, the latest bit of news is the Eden project is going to have a place in Dundee just along from the V&A. So that's again another development in Dundee. So it's a city that's a really exciting and vibrant place to live in at the moment. This is a picture actually taken from a drone in my back garden, showing the wonderful views that we have. Dundee sunsets in the summer and even in the winter can be phenomenal. So you can see, this is to my right would be the sea. You can see the 2 bridges. You can see the Port of Dundee, which is an active port. with oil rigs, supporting the oil industry and things like that. It's a beautiful place to stay. And not far away is St Andrews, for example. 25 minutes on a bus, half an hour on a bus, and you get to St Andrews and places like that. If you like golf or just like the seaside, it's the most incredible place to go for an evening, for a Saturday or a Sunday or whatever. So Dundee is a beautiful place to stay, and it's surrounded by beautiful countryside. If we come back to Dundee and look at the university, this is a picture of the university campus, and we are a campus university, and we're quite a compact campus. This is basically it. Down here we have the Perth Road, and this is the Hawk Hill, and the campus is really bounded in this space. The shops start down here, so the actual town, the shopping centre of Dundee starts here, and the university starts here. And the dental school is right on the sort of shopping side of Dundee. And so right on the campus and right close to the city centre. So we've got the benefit of being close to the city, but being amongst the student community, which again, for a dental school is sometimes quite unique, as many dental schools are often separate from the university, but we're part of the university and part of the city itself. And if you look at what's close by, this is the library building, or the Library and Learning Centre, a great resource space to come to support your learning. Right next door, the Student Union is here, which is not just a nightclub and a sports facility, a swimming pool. It's also a great hub for support. We've got tennis courts, we've got residences here and here and here, and many of our first year students live in this area here, very, very close to the university. In fact, you might say too close, because they can sleep in a bit too long sometimes. The Life Sciences building is here, and we use the facilities here for anatomy in the first, second, and even in parts of the third year of the course. And the river, this viewpoint here, looks across the river. So that's the campus. It's a very compact campus and a great place to be. This is the dental school. It wasn't taken this morning, but it was taken a couple of weeks ago from the car park on a sunny day. The dental school has been around for over 100 years in Dundee. As you can see, it's a mixture of old buildings and a newer sort of late 60s built tower block. So we celebrated our 100th anniversary, I think back in 2014, 15. And we're both a university building, but we're also a building that's supported by NHS Tayside. So we're a hospital and we're a school together, which is common for most dental schools in the country. So that's where we are at the moment. So most of the the dental hospital building is in the first 5 floors of the tower, alongside this bit over here. And the rest of it is teaching spaces, research laboratories, admin spaces, and staff offices. Dundee, we're quite proud of the reputation of Dundee. Obviously, there is rankings that you can look up. Dundee has always done rather well in the rankings. Indeed, the Scottish dental schools in general are at the top end of the rankings. As you can see there from the Guardian, the Times, the National Student Survey and things like that, Dundee has ranked very strongly, and it's something that we're very proud about, because these rankings are based very much on what students say about us, and it reflects what we aim to achieve, which is not just a good education, but an excellent student experience. So Dundee does well in the rankings, which is a really great place to be. If we look at what dentistry is, and just to introduce the course, because the dental course is a 5-year course, the BDS course, and it's an extensive program. And some people think, well, why is it such a long program? Well, at the end of it, you've got to qualify to be able to be registered with the regulator, which is the GDC, and have all the skills to basically make you an independent practitioner. So what is dentistry? Well, dentistry, you know, dentistry for some people is just checkups, and obviously dentists play a big role. A lot of dental disease is preventable, or if it's detected early, can be managed more straightforwardly. So a lot of what we do is dental examinations, radiographs, things like that. We do a lot of prevention, a lot of dental disease, dental decay, gum diseases, periodontal diseases are preventable. So a lot of what we do is around prevention. And if prevention totally works, there wouldn't be a need for the next stage. Unfortunately, it doesn't totally work. So, oral hygiene instruction, diet advice, ways of modifying teeth, for example, with fissure sealants are part of prevention. As part of prevention, we do perio treatment. We scale, we debride the teeth to remove hard deposits like calculus or tartar, so that patients can easily clean the teeth, or more easily clean the teeth, to maintain good gingival or gum health and good tooth health. Unfortunately, things don't always work out. Patients don't adhere to the preventative regimes, or patients don't come to seek help early enough, and we actually have to manage the disease. So, for example, dental decay, we can manage with fillings, for example, what we call plastic restorations, which may be things like amalgam, less commonly now, or resin white filling materials. So we can restore and replace damaged tissue. Sometimes, unfortunately, teeth disease progresses and it affects the pulp of the tooth, the nerve of the tooth, and if the tooth loses its vitality, it dies off, we'd have to do something like a root canal treatment. If the tooth becomes weakened because of disease or fracture, we may have to do advanced things like crowns. And sometimes we can't save teeth and we have to take teeth out. A lot of dentistry is actually not only just taking the teeth out, but dealing with the effect of tooth loss. So, for example, we might make a removable denture for a patient. We might make a bridge, which is a false tooth attached to one or more adjacent teeth. Or more commonly now, we might place an implant. So that's a lot of the tooth aspects of dentistry, which you may be familiar with. But dentistry is so much more. The mouth is a window on the general health of a person. And as dentists and dental therapists, we are examining patients' mouths in a very detailed way. So the mouth is important for general health. It's important to maintain function. We ingest food through the mouth, but also many diseases manifest first in the mouth. So as we are very clued in on what the mouth should look like, we can detect abnormalities and refer patients to the appropriate specialists to get things that we see as not quite right checked out. And that can lead to an early diagnosis. For example, a patient could have a cancer in their gut, and that can cause anemia, which doesn't necessarily manifest straight away in their general health, but that can cause changes in the mouth that we can pick up and say, yep, this patient could be anemic, get them checked out, and actually end up with an earlier diagnosis of a significant disease. So we're not only tooth savers, we can actually be lifesavers. There's infections in the mouth. It can be bacterial, viral, or fungal infections. And again, they may be a sign that the patient is not quite well overall, and the sign that something else is underlying that. Oral cancer, sadly, is a disease that's not going away. It's a disease that's on the increase, particularly in younger people. And if it's not caught early, it's a very significant disease to treat and is life-threatening. So we're involved in the detection and management of that. Trauma, patients fall off their bike, they sadly get assaulted. We deal with trauma. Pain in the mouth is very, very unpleasant. Not just tooth pain, but patients have chronic pains. And pains in the face are very hard to sort of dissociate yourself from. So we're involved in the management of pain conditions. involved in the management of developmental conditions that range from missing teeth to teeth that are not formed correctly to things like cleft lips and cleft palates. People are keeping their teeth longer, so we're looking at managing worn out dentitions. So tooth wear is a big thing. And obviously I've put it last, but a lot of dentistry for some practitioners and for some people is cosmetic, it's aesthetics. So some practices very much devote their service to the cosmetic side. So dentistry is a lot more than teeth, it's oral and dental health. So this is a picture that you can get out on Pinterest. It kind of sums up what a dentist should be. It's kind of partly a doctor because you have to know quite a lot about the body, how the body functions, the physiology and the human disease that patients may present with, so that you can be clued in to pick up signs earlier, but also know how to manage patients that might be on drugs. You're in part an engineer, you're very much a surgeon, you're a technical person. You're doing very, very fine surgery with very, very sort of dangerous instruments like drills and even scalpels and things like that. So you're an engineer, you're designing things, dentures, bridges, all these sorts of things as well. But also, I think dentists are very much artists. You are creating smiles, and smiles are important for a patient's well-being. So that kind of sums up, I think, what dentistry is quite nicely, albeit in a cliched way. So how about the dental program? Well, dentistry is regulated by the General Dental Council. So everything that we do has to be approved by the GDC. Because when you qualify as a dentist, and Maxine will talk later on about a therapist, you have to be at a level to register with the GDC. So it's worthwhile when you think about applying for dentistry and going through the interview process, is learning a bit about what the GDC expects from dentists, dental therapists, and indeed the wider dental team. And these documents you could download from their website. The green one here basically defines what every member of the team can do, because dentistry is very much a team thing. The dentist, dental therapist, dental hygienist, dental technician, dental nurse, and beyond is the dental team. So this book defines what we can do, the sort of procedures that we can do. This grey book is the standards document, which defines essentially what the GDC and the patients expect of dentists in terms of how we treat them and how we behave. And that's very, very important, because dental students and dental therapy students, you're not normal university students. You're expected to behave like professionals, to adhere to the standards of what we have to do as registrants with the GDC. And there's also this document on the right, which basically defines what every dental school has to deliver to allow our graduates to register and become dentists or dental therapists. So preparing for practice basically sort of blueprints the curriculum that we have to do. So when you choose a dental school, whichever school you go to in the country will have been through the rigorous approval and the regular approval of the GDC. So in many ways, your choice of school, wherever you go, you'll come out with a BDS degree in terms of dentistry that allows you to register with the GDC. So in the end, the educational outcome is the same. What's different, though, is in some ways that the subtle differences in the paths that different schools take to achieving that aim. So your choice of school in some ways is very much dependent on not what you get at the end, because you'll be a dentist or a therapist or whatever, is the subtleties of how you get there. And that's one thing. But speaking from a well-being point of view, it's finding somewhere that you're happy to live in terms of dentistry for 5 years. And in my case, I never moved away. So it's been 35 years, essentially not far off, that I've been in the area. So you've got to find somewhere that the curriculum appeals and the place appeals. So if you enjoy, say, Dundee, the demands and the stresses of the curriculum become a lot easier if you're happy in the place that you live in. So there's lots of things that would govern where you come to study. We'd love you to come study in Dundee. If Dundee's not right for you, then we'd rather you found somewhere that is right for you. So it's important you find that. So what about the curriculum in Dundee? Well, when you come to dental school, we take in, roughly between 55 and 60 students into first year, and they come from a broad range of backgrounds. They come from overseas, they come from the UK, Scotland, Northern Ireland, England, Wales, and even Europe as well. All the students come with a different background, and our job is to transition you from a new entrant student into a student dentist, and in the end, into a graduate dentist, so that you can qualify and go out into supported independent practice at the next stage of your career, your lifelong learning career. So one of the big things is the transition from coming in, but also to being a student dentist. And the traditional way of doing it in dental schools is to give you 2 years, which are essentially pre-clinical, where you prepare for clinics, and then you start doing clinics in third year. And that's what I did as an undergraduate. You spent basically 2 years as a science student, and then you learned some operative skills, some drilling skills, some hand instrumentation skills, but you didn't treat a patient until third year. And then you started treating patients in every discipline. So you're doing fillings, you're doing perio treatment, you're treating children, you're doing dentures, and you're pulling teeth out, and you're examining people suddenly at the start of third year. I believe that's quite a stressful transition. So one of the things about the programme in Dundee is to bring clinical practice right to the start of the course. So this transition from new student to student dentist is not an abrupt overnight transition. It's a gradual transition that takes place over the course. So in first year, the course has been designed so that you start your clinical experience actually in week 0, and you actually do things on a clinic properly in week 1, and you're actually doing things on each other throughout the first semester and treating your first patient, albeit in a very simple way, with a dental examination in semester 2 of year 1. And we basically ramp up the clinical experience in the students. So the course, we call it the 4D curriculum. Why do we call it the 4D curriculum? Well, it's dentistry at Dundee, driven by discovery. Why discovery? Well, discovery, if you look at Dundee, tourist pages, Dundee, a lot of Dundee's history is linked around a ship, which is in a dry dock down beside the V&A, and that's the Discovery, which is the ship that went off to explore Antarctica, and it was built in Dundee. So Dundee is often referred to as the city of discovery, but discovery is also about the ethos of the curriculum. We want students to be, and the regulator wants students to be lifelong learners. So rather than spoon feeding you with lecture from day 1, as I used to do to students and was done to me, the aim of the course is to introduce a supported learning environment so that students develop the learning skills to become lifelong self-motivated, self-directed learners. So it's a course that we aim to achieve that with. The aim of the programme is to produce students that are well-rounded graduates who put their interests of patients first, that they're sort of safe, they're reflective practitioners, they're able to maintain the registration with their registrant, registration body, which in the UK is the GDC. But we also want them to be lifelong learners and innovators and leaders in the profession. That's what we want our students to be. So what's the key bits about the curriculum that we try to help facilitate this journey, because dentistry is a journey between staff and students. So they say the first thing is this notion of transitions. We used to, and many schools still do, you come in at year one, week one, and we hit you with some hardcore science. That's fine. The science is good, it's important. But you're actually coming to dental school to become a dentist or dental therapist. So when you come to Dundee, you don't start off your first day doing membrane physiology. We start off exploring dentistry because that's what you're here to do. We explore what it is to be a dentist, what it is to be a professional that's regulated, what it is to be a lifelong learner, what it is to be a professional student, how that impacts how you may use social media, for example, how the dental team works, how it works in the wider health community. So we spend the first time in the course actually understanding what it is to be a dentist or a dental therapist. We also aim to give you the skills to be able to be a lifelong learner. How do you use a library? How do you appraise and assess information? We're in the age of information's everywhere. You know, we see patients, you know, in the COVID situation, you know, choosing their vaccine type based on what's on social media, or choosing not to have a vaccine based on what they read on social media. You know, there's so much information out there, and as professionals, we have to be able to distill down through that. So we spend time at the start of the curriculum before we bed down into the science, into the clinical practice, in exploring what it is to be a dentist. And this transition to student dentist is a gradual one. We gradually build skills incrementally from the start of the course to the end of the course. At the end of the course, the aim is to prepare you to leave and become practitioners in the next stage of training, which is in the UK, some sort of vocational training. Key to the transitions and the structure of the curriculum is integration. As I've said, dentistry involves a lot of understanding of science to support the clinical practice. We therefore have taken a conscious decision to bring the clinical practice and the science closer together, so that rather than teaching lots of good science at the start, out of context with clinical, we try to keep the science totally in context, such that you explore the science in relation to how you'll use that in clinical practice, which is important. We try to make it engaging, so it's more learning versus than telling, and that's how we structure the exercises that we give for you to do. It's not all lecture based, although it's not a problem based curriculum. There still is what we call interactive classes, which sometimes are lecture type classes, but we have activities based around core clinical cases, particularly early on in the course, where you do group work and present group work right from the start. And we've changed the assessment to focus, yes, there's end of module exams, but there's also an increased focus on assignments, project work, presentations, and things like that. So the assessments become much more contemporary. And we've looked at how we can innovate using educational techniques and different technologies as well. So this is the course. It's sort of mapped out in icons, and there's 9 modules, 2 per year apart from final year. And basically what we do is build the skills. So for example, in module 1, which is the first half of first year, essentially up to Christmas, the end point of that module really is to be able to carry out a history and an examination on a simulated patient. Not a real patient, but a simulated patient. So you think, well, what do you need to do that? Well, you need to know what it is to be a professional, how you work with your colleagues, teamwork. You need to know how to communicate with that patient. So communication skills. You need to know about those and have those skills. To understand what you're looking at and what you're going to take in your history, you need to know a bit about medicine. So obviously common diseases now are things like heart disease, respiratory disease. I'm suffering from bad asthma at the moment. A lot of patients have asthma and respiratory diseases. You therefore, to take a history, need to know a bit about these diseases, but also need to know a bit about the physiology, about how the heart and the lungs work. So we introduce cardiovascular and respiratory physiology, because that's the common sort of systems that patients will present with diseases from. To look at the mouth, you need to know the anatomy of the mouth. So you need to know what teeth look like, what the normal anatomy of the mouth is. You need to know about cross-infection. So you learn about infection control very, very early on. So module 1 is geared around giving you the knowledge and skills. And skills development as well is important. You know, we can't assume that everybody comes in with fine hand skills, motor skills, to allow them to be able to use a drill or use a hand instrument. So in semester 1, module 1, we start in the Phantom Head Lab, learning how to use and work in a simulated mouth. So we practice basic scaling skills in module 1. And this basically increases, we increase the complexity as we go through the course. So we do a fair amount of anatomy in years 1 and 2 of the course in particular. Now I can't show you what we do because we're not allowed to show pictures of the anatomy facility, but Dundee has the state-of-the-art anatomy facility. It's a teal facility with cadavers that we can dissect that are much more lifelike than the normal facilities that are often being phased away from curricula in other schools. So we've got a state-of-the-art anatomy facility. And what is amazing about it, again down to the integration of it, is that we can actually use the anatomy facility not just to learn the anatomy, but at the same time to learn the clinical practice. I teach local anaesthesia. The students learn the anatomy of local anaesthesia, and then the plan is that they practice it actually in anatomy, not on each other. They practice it in anatomy, and we can then learn the skills and relate them to the science, to the anatomy. We also do different things as well. We can explore anatomy with 3D models. With the COVID restrictions we've got at the moment, students have used 3D models online a lot more as we've coped with the restrictions. Here's a picture. You'll hear Gigi very soon. This is from her year. We do things like looking at surface anatomy through things like face painting, art, being creative, because dentistry is creative. And students present to their class what they have demonstrated in terms of surface anatomy. We've got 3D models that we use, and this has come in very, very handy over the times when we've not been able to get together face to face. So we have online libraries for anatomy that we can use and our students can use. On the clinic, we look at clinical skills, initially of communication, how to speak to the patient, how to get a history from a patient, how to support a patient who is maybe a bit anxious. And let's face it, many of our patients are. And then we start to practice clinical skills, how to examine the mouth, how to examine outside the mouth and inside the mouth. This is a Phantom Head Lab. This is a dental therapy student, if you notice here on the badge. The students work together, particularly in first and a large part of second year. So this is the skills of hand instrumentation, scaling teeth, gets you used to working in the patient environment. It's about discovery. We have a week. Here's Gigi, who you'll see in a few minutes' time. We have a week called Discovery Week, which allows students to go away and explore a topic of their interest and produce a presentation at the end of the week, getting them to research things and have a sort of mini student conference. This was Gigi's work and Grace's work on the impact of dentistry in social media. So it's hard work, no question it's hard work, but we do want it to be fun as well. It's a learning journey that is a demanding one, but we want it to be interesting. So the course basically rolls out in module 2, the skills that you've gained in module 1, i.e. to do an examination on a patient and maybe even to scale their teeth. You've gained the skills, you're signed off on those skills, you're able to then take those skills onto the clinic and actually see a real patient, maybe even scale the teeth of a real patient. So by the end of year 1, you can leave dental school by saying, I've treated a patient, I'm on my way to being a dentist. Which I think is quite an incredible thing. In year 1, you start to learn, for example, how to drill a tooth. Using a drill is a complex thing to do. It's just that in year 2, we give you the skills and the knowledge to do anesthesia, for example, and learn more about dental disease. Such that in year 2, you can start to work on real patients. And by the end of year 2, in normal times, and in fact, some of Gigi's year actually did fillings on patients before Easter of year 2. And as they enter year 3, they start to learn additional skills, root canal treatments, denture making skills, fixed prosthodontic skills, and these skills just expand gradually as the course goes on. So that's a little bit about the course. So you can see we use software to learn. This is learning anesthesia. Students work together in pairs at times, not always, supported by dental nurses, sometimes supported by each other. And the clinical skills get more complicated as we go through the course. This is denture work in the laboratory. This is just a funny picture of thinking in a detailed way as a dental team. This is endodontics. We have a master's in endodontics program, and therefore we have a lot of skilled staff in endodontics, and that filters down into the course. And our students not only engage with the course, but they engage beyond that. One thing that Dundee is quite famous for is the Wikipedia collaboration amongst dental schools across the world. And that's something that has been driven by students, supported by staff, and is a huge project. And it just illustrates, I think, the drive and the motivation of our student community to learn and help others. And basically, through this project, help the evidence base that's out there to professionals and to patients alike. So that's a bit about the programme. I guess one thing that is worth talking about just briefly is COVID. And as you know, the dental school is not taking an entry this September. So you're looking at applying in October for next September. COVID has hit dental schools across the UK in different ways, but in a big way. In Scotland, certainly, the dental schools have worked together to mitigate and to manage the situation that we're in. And what Scotland has done is taken quite a cautious approach and extended the course for all current students for an extra year. So we have no first year intake this September, but we have a first year intake next September. By then, we envisage that things will be getting back to as near normal as we can. But it's been a challenge. Dundee has led the way. Our clinics look different at the moment. This is the clinic that both Fiona and I would normally work on, and it's been transformed. So students can do procedures on patients safely. These tents built around the chairs hit the news recently because it's an innovation that's come from a collaboration between the NHS in Dundee and actually the oil industry. These tents are pods that allow students to do procedures that generate aerosols, which drilling scaling and many things like that do in a safe way, safe for staff, safe for patients, and allows us to start to get back to near a closer to normal supervision. Now, whether they'll have gone by the time you get to do these things, we don't know. The pandemic is changing, as we all sadly see. I don't think any of us envisaged it would be in this situation at this over a year later. But Dundee has invested heavily in these pods and is investing heavily in refurbishing the clinic. This is a newly refurbished clinic, and over the summer there's going to be refurbishment of all the other floors that don't have the most up-to-date equipment. So I think they're putting in 50 new dental units across the building. So we'll have a state-of-the-art facility. These tents may still be there, they may disappear throughout your clinical training. We hope that they will, as the pandemic becomes a thing of history. But a lot of lessons have been learned. Very finally, supporting students. I think it's important to understand that coming to dentistry is a demanding course. You've got lots of competing activities. You've got academic demands, clinical demands, the demands to behave professionally. There's lots of temptations out there. As a dental student, you've got to think as a professional. You're working with patients, particularly from the start. You've got new challenges away from home, new colleagues, financial worries, flats, cooking, health, sometimes family worries. A lot of our dental students are perfectionists, I know from personal experience. Lots of things make life stressful. Coming to Dundee, we try to support you as best we can. We have a support system in the school through the Advisor of Studies, which is a system that I lead up, the support through occupational health. We have mental health first aiders, we have student welfare ambassadors, we have student buddies, and therefore we try to support students through the journey, which can be challenging. Most of our students sail through it, some of them don't, and it's our role to support them. But we also have a significant level of support out with the school as well from the university. And I've got 3 daughters who all 3 have been through university, different universities, and I have to say they've also had problems, and the support that they've received, I would argue, is not as good as the support that students in Dundee as a whole receives. So yes, it's a demanding course. Make sure that you choose that it's the right course for you by getting whatever experience you can. Make sure you choose the right place to study, and that's down to not just the course and the style of the course, that's also down to the place. I think that's really, really important. I chose Dundee because I wanted to live by the coast and the outdoors and have access to Scotland. My family from Scotland, even though I was born and brought up near Manchester, and I've not moved away. So the place is a big thing, but that's what I've got to say. Thank you for putting up with my croaky voice. If you have any questions, feel free to post them, or you can ask through the normal channels. Thank you very much.
Thank you very much, Andrew. That was very informative. I hope you feel better soon as well.
All right.
So we were scheduled to have a wee 5-minute break, so I think we'll just do that just now, just to give people a little rest, and then we will hear from Fiona about our applications process, and there will be a chance for some Q&A there as well.
Amy, I'll just put up my slide.
Perfect. I was just about to ask you to do that.
Yeah. Can you see that?
Yep, I can see that. It's all full screen and everything as well. Yeah, I think we'll just take a couple minutes just so people can stretch their legs and grab a cup of tea if they want, but then we'll just carry on in the interest of time. So.
Okay.
Well, hopefully everyone's had a chance to stretch their legs and grab a wee cup of juice or something. If you're ready, Fiona, we'll just carry on with the next presentation about the admissions process into dentistry.
That's fine, thank you. So I'm going to talk now about how you get into the dentistry course. So there are a number of academic requirements that I'll move on to, but I want to start off by talking about the non-academic requirements of accessing the course. We do not stipulate that work experience is essential, but we do advise that people should try their very best to gain some work experience, and usually around 2 weeks is sufficient. Now, we're very aware that there have been big issues in organising this in the last year, just over a year, due to COVID-19. But there are some alternatives to find out about a career in dentistry. You could ask your own dentist. That's quite a good way to find out, and just to ask them what it's like to work as a dentist and the pros and the cons, and maybe to talk through what an average day is like for them. You could also speak to someone who's a dental student. Now, if you're not sure if you know anyone who's a dental student, then you could ask your careers advisor at school, because there's a reasonable chance that someone in the past has gone on to study dentistry. So they might be able to put you in touch with them. So it would be good to speak to someone who has experience of the dental profession. If you can't speak to a dentist or a dental student, then, speaking to someone who's a dental therapist or a hygienist, or a dental nurse, and they can all tell you a little bit about what the day-to-day life in dentistry is all about. The other thing you can do is just keep up to date. There's been a lot of information in the news over the last year about how severely dentistry has been affected by COVID-19. Andrew touched on it in his presentation just before this, and it's well worth reading news articles and things that are readily available on the internet about the effect on dentistry and other healthcare professions as well. And really the aim with work experience or speaking to people in the profession is just to make sure that you're making an informed decision that dentistry is the right career for you. Because, and Andrew again has mentioned it when he's been talking about the course, it's quite an intensive course, it's a long course, and you really want to try and make the right decision for you before you commence studying. There might be opportunities to shadow your own dentist or another dentist later this year or into next year. But at the moment, then, what I've mentioned just now would be sufficient to allow you to make an informed decision. We're also looking at you as a person and your interests and your abilities and in a number of different areas. So the kind of person that we're looking for is someone who has the appropriate attributes for someone working in a healthcare profession, and particularly a very hands-on healthcare profession. So we're looking for someone who perhaps has hobbies that require good coordination, and it might be intricate work, whether it's sewing or knitting or musical or woodwork or whatever, that kind of good coordination skill requirement. We're looking for people who like and work well in a team environment, because once again, Andrew mentioned it, dentistry is all about working in a team. And another really important thing in dentistry and all healthcare professions really is that reflection is a very important part. So you will do something and then you must reflect upon it. And we get our students to do this all the time when they are carrying out clinical work. So you'll look at it and you think about what went well, what didn't go well, and what you would do differently on another occasion. Other personal traits, we're looking for people who are empathic and caring, because this is a caring profession. You need to be a good communicator, because communication is a huge part of working in dentistry. Whichever member of the team you are, communication is essential. And you also need to respect your other team members and your patients. Problem solving is an important attribute as well, because we're faced with problems throughout our working lives. And, you know, there might not be a right and wrong answer for some issues that patients might have. You know, some issues could be dealt with in a number of different ways, but you need to have that problem solving ability to work well within this profession. You also need to be organised because dentistry is, you know, it's a busy working life, and you need to be organised in that. And you also need to be honest as well. It's a really important part of the professionalism side of dentistry. Now, I've also mentioned a safety valve here as well. So I think it's really important that you have other interests as well as just focusing on dentistry, because you need something to relax, and I always call it a safety valve. So, you know, it's very important that you maintain interests or you build new interests when you start studying and working in the dental profession, because you need something by way of relaxation from this quite intensive work environment that you'll be in. The university gathers contextual factors about all applicants to all different courses, and this can allow slightly different entry requirements for some people. So the university will gather information on attendance at schools where there's not high progression on to further education. They'll also collect information on the Scottish Index of Multiple Deprivation and where people are living, or whether people have care experience, whether they've been a carer or been in care. Perhaps there's a widening access programme called REACH, and we'll, you know, take note of whether people have been involved in that, whether through Dundee or Glasgow or whatever. So these are things that are gathered centrally, but if there has been other adversity that you have faced, then it's really important that that is included in the reference that your school does for you. So, you know, it would be important to notify and to have a discussion with the person who will be doing your reference to make sure that that is included. In terms of academic entry requirements, our standard minimum entry requirements are 4 A's and 1 B at higher. These should all be taken in one sitting. And then in 6th year, we would be looking for advanced higher biology or chemistry, plus another 2 subjects, either at higher or advanced higher level. And usually Scottish candidates will apply after 5th year, and they will be given a conditional offer if they are successful, and the conditional offer would usually be for Bs in the 3 subjects that they were taking in 6th year. But as I say, one of those subjects in 6th year should be advanced higher biology or chemistry. For A-level candidates, the entry requirements are 3 A's. And again, we are looking for the same as hires. We were looking for biology, preferably human biology, and chemistry in the A's that are achieved both at higher and at A-level. For those taking the International Baccalaureate, we're looking for 37 points, and biology and chemistry should both be at higher level as well. We have quite a number of candidates who apply as graduates who have done a degree already, usually in a life sciences subject, and the requirement there is for an honours degree with either an upper second class or a first class qualification in that. For those with contextual factors, then the entry requirements are slightly different. They are 3 A's and 2 B's at higher. That should include A's in both chemistry and biology. And we're also looking for a B in advanced higher chemistry or biology. But these qualifications have all to be achieved by the end of 6th year. So they can be split between 5th and 6th year. We don't stipulate on a minimum entry requirement by the end of 5th year for this group of candidates. For the entry for widening access, we also ask that candidates will do a compulsory University of Dundee summer school, which is a really good introduction to university. And that is run in June into July. And we've had quite a number of our students who have done this and found it really useful and an excellent preparation for university and moving on to a course, particularly dentistry when it is quite intensive and quite long. The personal statement, oh gosh, people put so much effort into their personal statement, and I have to be very frank with you now, and we do not use personal statements to select candidates for interview. I will just talk shortly on what is used for selection to interview, but personal statements are not. However, your personal statement will be used at the interview stage if you're selected for interview, and we base some of the interview questions on this. The personal statement should really include information about why you want to study dentistry and what you've done to find out about a career in dentistry. So it's that informed decision that you've taken for studying dentistry. And also going back to the other requirements that I talked about and the attributes, then you should make mention of where you've demonstrated these attributes, whether it's team working in the school environment, in studying or whatever, or whether it is in sport or voluntary work. That would be community involvement and also team working. And we want to have just some evidence of you, the fact that you've used your communication skills as well. So these are just examples, but just demonstrating some of the attributes that are important for someone entering the dental profession. The reference is important, and schools are in general very aware of this. It should include your preparedness to study dentistry. As I just mentioned, it should include any adverse factors that might have affected your academic performance to date, and that's really important. And it should also include whether the school has any policies that restrict the number of hires that can be done in one sitting, or whether there's restrictions on subject choices and things like that, because that can affect some candidates' ability to meet the entry requirements. So we can't count it against you, the fact that your school has policy that doesn't allow you to do these things. If your school does have a policy like that, it's probably worth contacting the contact us at dundee.ac.uk email address just for advice on how to proceed at that point. UCAT is a big part of the application process as well, and that has to be done prior to a UCAS application being submitted. So last year the testing was all online, and it is hoped that the testing will actually be resuming in test centres this year, and that is the plan at the moment. I think it depends a little bit on the COVID restrictions, and if a UCAT find that there's not sufficient capacity at the test centres, then they might allow some online testing to be done as well. But I would advise getting registered as soon as possible for UCAT. Although booking doesn't open till the 28th of June, registration is already open, and so you would be able to register to take the test over the summer period. Testing cycle is between the 26th of July and 29th of September this year. I always advise that you should take the test earlier rather than later. There's usually a financial incentive in terms of the fee for the test to take it that bit earlier. But it also means that if it comes to testing day and you're unwell for any reason or not able to do the test, then there's still time to reschedule your test should you wish to. I think it's important to prepare for your UCAT, and the website has quite a number of helpful tools on there. There are question banks. So it allows you to become familiar with the type of questions that are involved in the different sections of the test. And there are also practice tests that you can undertake. And I would suggest that once you've become familiar with the type of questions, then you should do practice tests under timed conditions, because that is usually the limiting factor for people, that they tend to run out of time in the different sections. There are various books and courses that can be done. Some people choose to do courses. There are books that you might be able to get out the library. That, you know, the more practice you do from books, the better. I've had varied feedback from courses. Some have found them useful, some have not. But really, there is a lot of information on the UCAT website, so that should be sufficient for preparation for the test. You're only able to take the test once each cycle, so that's why I say if you are unwell, then I would reschedule the test, because you really want to be on the ball when you do the test, because it's your one attempt during that cycle. The UCAT website has a huge amount of information on it, and it tells about the bursary scheme. So some people will be eligible for the test at no charge. And there are also various different access arrangements. So for people who get extra time in exams at school and things like that, then there are different access arrangements for different forms of the test. So please take time to go through the UCAT website and read all of that information. We do not operate a cut-off score for UCAT, and that's something that I'm always asked, but we don't have a cut-off score. What we do is divide the scores into deciles, so you know, the 10 different blocks, and the highest scorer in the top block, and that is used for selection for interview. I'm always asked about what is a good UCAT score. So it's what I usually say is, well, the average score for invitation to interview in the previous cycle is whatever, and that tends to vary quite a lot. So this year, the average score for an invitation to interview in the cycle that we've just been running was 2,558. Last year, it was about 150 points lower than that, but average scores vary from year to year, so you can't really use too much, or read too much into that. But that just gives you a rough idea of what kind of score is getting an interview. So selection for interview is based slightly differently for school leavers and for graduates. So we will score your achievements to date academically, and we will use that along with the decile of your UCAT. So 60% is based on your academic score and 40% on your UCAT if you're a school leaver. Now these proportions are reversed for graduates, so there's more emphasis on the UCAT score and a bit less on the academic score. That is really because graduates have proven their worth really by having achieved an upper second or a first class honours degree. So the academic score isn't quite so important, but we put more emphasis on UCAT at that stage. Now, we would normally, and this is something that we really like doing, is inviting candidates to Dundee for interviews. But last year we held our interviews online, and we'll be doing the same again this year. So what we like about inviting people to Dundee is they get to meet some of the staff and the students during the interview process, and they also get to see around the facilities in the dental school. However, we're going to have to rely on virtual tours, although there might be tours available later on in the academic year next year. So the interviews are based on multiple mini interviews, but it's just one panel of, it will be a panel probably of 2 members of staff and 1 student, and they will cover a number of different themes. So it will be like doing a number of different multiple mini interview stations, but just with the same panel rather than moving around. So they cover a variety of themes really, but you know, they'll cover things like your preparation for studying dentistry. There'll be discussion on a variety of different topics, and there'll also be some role playing involved with that as well. The 3 interviewers will all score each candidate independently, and the offers will be based on your score at interview. So once you are selected for interview, we will put your performance at UCAT and your academic score to the side, and it's just performance on interview that will lead to the offers. So it's important to just try and prepare yourself as best as possible for the interview. And the kind of things that we're looking for people who are interviewed is, well, again, it's a good way for us to see how good a communicator candidates are. We're looking for people who are prepared and who are motivated to study dentistry, that they can work in a team, that they have the skills of critical thinking and integrity and moral reasoning. So these are the kind of things we're looking for at interview. In terms of a timeline, for entry in September 2022, applications should be in by October the 15th through UCAS. We will be holding our online interviews between December and February, and then in March, candidates will be told whether they've been successful in their interview, and offers will go out at that stage. So because we have not had an entry in September of this year, the candidates who applied in October of 2020 have been offered places to fill half of the starting places for September 22. So we would normally have about 57, 58 students starting in September. So we offered half of those places to the candidates who have already applied, and there'll be the other half of those places available for the next lot of candidates who apply by October of this year. So for the cycle that we've just run, there were about 29 places available. We had 639 applications. We interviewed 335 and made 129 offers. Now that seems a lot of offers, but you have to remember that people get offers from a whole variety of different dental schools, either in Scotland or in the UK. So we work with our previous acceptance percentages to decide how many offers to make at that stage. And that really covers the whole application process. Please feel free to take a note of my email address. I'm happy to answer any emails, or if it's a kind of general, I can answer things specific to dentistry. If it's more general admissions query, then please use the contact us at dundee.ac.uk email address, and the general admissions team will help then. I hope that you found that useful. Thank you.
Thank you very much, Shona. That was indeed very, very useful. Yeah, if someone would like to pop Fiona's email address into the chat box for people as well, that would be really, really helpful. So you can email her if you have any questions. You'll be inundated with requests after this, Fiona. So next up we
Probably.
have yeah. Next up we have Maxine Lee, who's going to talk to us about the Oral Health Sciences programme. So if Maxine, you'd like to share your PowerPoint, we can get you set up and ready to go. I think you're on mute, Maxine. I can see you, but I can't hear you.
Sorry.
It's okay, we all do it.
Can you hear me now?
I can hear you and see you.
Have a look at my screen. Can you see my screen now?
Yep, and I've got your PowerPoint.
Thank you.
There we go.
Okay, so the Oral Health Sciences programme is the second undergraduate programme that is run within Dundee Dental School, and it's a BSc ordinary degree that the students graduate as dental therapists from. So if you want to graduate as a dental therapist, you need to do a BSc in Oral Health Sciences. Now, we've heard quite a lot already from Dr. Mason about what a fantastic place Dundee is to study in, so I'm going to skip over a few slides that gives an overview of the rankings for Dundee University that we've already seen this morning, about the campus and where the campus is, and what a fantastic time our students have in Dundee, because I think we've covered that quite well already this morning. And what I'm going to do is go straight to talk about the programme itself. So you know already that we are ranked currently as second in the UK for dentistry. The rankings according to which source you look at changes, but we're up there with the best in the country for dentistry. And Dundee Dental Hospital and School is full of academics and staff who have trained there and come back to teach, and I'm one of them as well. It's an extremely friendly dental school with a real sense of community. The students are never strangers. Once they've graduated, they tend to come back to see us regularly, because great relationships are forged at the dental school. We're not the biggest dental school in the country, and I think that's an advantage, both for the staff and for the students. You've already seen quite a bit about our excellent facilities as well. And the dental students and the dental therapy students share the facilities within the dental school. So the clinics are run as combined clinics. We share the clinical space, but we also share the phantom head room where you've got simulated heads with plastic teeth. And that is where you learn to treat gum disease and where you learn to restore teeth as well as a dental therapist. So moving on to talk about the degree itself in Oral Health Sciences. It's not an honours degree, it's a 3-year degree, so the programme does not, you don't graduate with honours, you graduate with an ordinary BSc in Oral Health Sciences, but you are able to practice as a dental hygienist therapist, and there are kind of 2 aspects to that, so I'll speak about both. First of all, dental hygiene allows you to prevent dental disease and treat gum disease. So most of you will be probably more familiar about the remit or the scope of practice of a dental hygienist, but I'll run through a few things that you are able to do as a dental hygienist. You're able to provide preventive treatments to the teeth, so for example fluoride treatments and fissure sealants, which are plastic coatings on the molar and premolar teeth to prevent dental decay. You're permitted to take dental radiographs. It's very important as a dental therapist that you're able to diagnose disease. Now with the advent of direct access, dental therapists are able to diagnose for themselves. In the past, it used to be that a dentist had to examine the patient before the dental therapist treated the patient, and the dentist had to diagnose and do a plan for the treatment for the patient. Now, as a dental therapist, you're trained to do that yourself, and the taking of dental radiographs is very, very important in that diagnostic process. Not just for dental decay, but for dental, periodontal disease or gum disease as well. So that you can carry out the treatments, you need to be able to give anaesthetics to the patient, so you're able to give injections to numb the teeth and the gums. You're able to take dental impressions to form models of the teeth. And a huge part of the role of a dental hygienist and therapist is that you are able to give health education, dental health education to your patients on a one-to-one basis or in a group situation. And we train you to be able to do both well. At about 2004, the Scottish government and the UK government decided there wasn't enough dentists to supply the demand for dental care in the country, and therefore they decided to ramp up the training of dental therapists. And that was so that dental therapists could treat extensive amounts of caries in the country in children and in adults. So the dental therapy aspect of the BSc degree allows you to undertake routine restorations, fillings in both baby teeth and adult teeth. It's a common misconception that dental therapists only treat children's teeth, and that's not correct. But I understand where that comes from, because the early dental therapists that were trained back in the 60s were trained only to treat children. But as a dental therapist training nowadays, you will be able to do all the types of direct restorations or restorations that are done on the day without the use of a laboratory that a dentist does. Okay, so you can see some fillings at the bottom left of the screen there. Now, if you look to the middle of the right of the screen, you can see a before and after where you've got a child's molar tooth that's heavily decayed. You can see the light brown dentine of the tooth that's very decayed in the before picture, and you can see a stainless steel crown that has been placed over the tooth. That is the new way of treating children's molar teeth that have extensive dental decay. And the theory behind that is that you seal in the bacteria that's causing the decay, you seal in the bacteria away from the sugar in the diet, and this stainless steel crown we're using more and more to cover over the decayed tooth, in the hope that the tooth will survive long enough before it naturally comes out when the new tooth comes through. Now, we only do that in children's teeth, but as a dental therapist, we are doing more and more of these pre-formed crowns in children's teeth. So that's part of the remit of a dental therapist. Sometimes the decay is so extensive in the baby tooth that you have to do some pulp treatment first. And that involves removing part of the diseased tissue within the nerve of the tooth. And you can see that as in the top picture on the slide, where you removed part of the pulp, the decayed part of the pulp tissue, and the best restoration after that is to place one of these preformed crowns over the top. So it's quite extensive. Where possible, we always try to save baby teeth, but when all else fails and the tooth is beyond pulp treatment and beyond a stainless steel crown, you as a dental therapist would be permitted to extract the tooth. So that's the remit of a dental hygienist and a dental therapist. What about when you graduate? What can you do with your degree in dental therapy? Well, it's good to know that all of our graduates are in work or further study within 6 months after graduation. We're very good at keeping in touch with our graduates and finding out what they're up to. Most of the graduates go into general practice, so general dental practice where they can carry out their full remit as a dental hygienist and therapist. Some are self-employed and some are employed. Others tend to go into specialist practices. So these are dental practices that have a specialty, for example, treating gum disease or placing dental implants, and use the help of a dental therapist as part of the dental team there. A good proportion also go to the public dental service. Now that used to be the community dentist, if you like, or the school dentist, if you remember that from years and years ago. These dental services now tend to take more challenging cases. So perhaps you've got a patient who perhaps has a challenging medical condition or a condition in their medical history that makes the treatment more difficult or more time consuming, or perhaps you may have a patient who's particularly anxious. These dental professionals within the public dental service have a little bit more time and expertise to treat patients with specialist needs. And there's a lot of health promotion happens through the public dental service. It's these services that visit the schools to do the screening and things like that. So the public dental service is a fantastic career opportunity for someone who graduates as a dental therapist and really wants to make a difference. You might want to come back to dental school, work within the dental hospital as a staff member, treating patients who've been referred in for secondary care, or you might want to teach. You might want to get involved in teaching future dental hygienists and therapists. And a small proportion go on to work within the armed services or in industry. So there are a really good array of different opportunities available to you if you want to go straight into work after graduation. What about the course itself? Well, at the moment, the BSc in Oral Health Sciences is integrated with dentistry for the first 2 years. So the dental therapy students train alongside the dental students for year 1 and year 2. Each year is split into 2 modules. So we say that you're integrated from module 1 to module 4. And that's what's going on right now, but it is subject to review. Therefore, I cannot guarantee that by the time you begin at Dundee that will still be the case. We will have lots of integration, but I can't guarantee that it will be the full 4 modules that will be integrated. So at the moment, we have module 1 with, as Dr. Mason said, the foundations of what it is to become a dental therapist or a dentist. You need to know what is the law behind dentistry. You know, how can you treat a patient safely? What about the medical conditions that a patient might have that might affect the treatment that you want to give to your patient? We need to give you the basics of head and neck anatomy and general anatomy and the way that the body works in health, and the formation of the body and oral biology and the teeth and the structures of the mouth. So this gives you a real clinical basis from which to build over the next 3 years. Now, as a dental therapy student, that theoretical teaching happens alongside a phantom head course. Now that's what you can see in the picture there. You've got some dental therapy students who are in the clinical skills room with the phantom heads, and these are students who are learning to treat periodontal disease or gum disease, and they're learning to scale teeth. What we have is plastic models that we dip in plaster, and we develop your hand muscles by scaling off the plaster, and then once we've got your muscles developed, we go on to finer scaling where we dip the teeth into enamel paint and you're trained to scale off the enamel paint safely. You do a gateway assessment at the end of the first term, so you would begin in September and do your gateway assessment in December, and if you pass this practical gateway test on the phantom head, you are ready to treat your patients for periodontal disease in the January after your Christmas break in module 2. Now, the theory that goes into Module 2 is you've already learned about the human body and health and the systems of the body and health. So now we start to look at the pathology. So what happens to the human body and disease? Because as Dr. Mason said, the mouth is the mirror of the health of the body, and we need to know all about these diseases that our patients may suffer from that can have oral manifestations or may have effects on the amount of or the type of dental treatments that we can perform on our patients. You also start to look at microbiology, and that is looking at the bacteria and the organisms within the human body, and particularly those that cause dental decay or dental caries and those that cause periodontal disease. And if you understand these organisms, then you can better understand the disease processes that you are going to spend the rest of your career treating. So that's the theory in Module 2. Again, as I said, it's alongside the dental students. And in between the theory, you will have clinics, a couple of clinics per week, where you treat patients within the periodontal clinic who have gum disease. On to Module 3 and 4. So that is year 2 of the BSc. You begin to learn all about treating dental decay and how to do fillings in adult patients. We learn about the materials that we use to fill teeth, and alongside that you are in the phantom headroom in the first term in Module 3 doing restorations or fillings within plastic teeth. We do give you some extracted teeth as well, so that you learn how it feels to cut into real enamel and real dentine, and we get some teeth that have been extracted that have dental decay in them so that you can feel how that is as well. Into Module 4, we start you with your radiology training, so you learn how to take dental radiographs. We do a lot of behavioural sciences with you, so you're learning to communicate with your patients better and learn how to evoke behavioural change within your patients. You might have some patients who you need to do some dietary advice with, or perhaps you need to do some smoking cessation advice with. And alongside that, you'll be learning how to do your local anaesthesia training as well. So you'll be learning to give injections so that when you do go on to Module 4 clinical practice and you're doing fillings in permanent teeth of adult patients, you can numb the patient up, the tooth up, before you do the filling. Module 5 and 6 is year 3 in the BSc. Now this is not integrated with the dental course, the dentistry course at all. It's bespoke to the BSc programme, and the reason for that is that you're in your final year of the BSc and it's very, very clinical. We need to get you ready for graduation. This is the time that we get you started with children's dentistry and clinical skills. Slightly different from treating adult teeth, so we take you back into the phantom headroom so that you can learn how to restore children's teeth and learn how to do the pulp therapy and these stainless steel crowns that we saw earlier. And alongside that, you learn more about management skills, leadership, doing public health and law and professionalism around your practice. There's very, very little theory in third year. It's a lot of clinical work. So you put everything together. You're restoring adult teeth, you're restoring children's teeth in the paediatrics clinics, and you are treating periodontal disease. So you're doing your full scope of practice as a therapist within third year. But the difference for third year is that you don't just do that within the dental school. We send you out into outreach clinics where you are also supervised, treating patients in clinics out with the dental school. Just allows you to spread your wings a little bit and get a little bit of experience out with the dental school. Dr. Mason spoke already about the new curriculum and the way that learning and assessment has changed significantly with the advent of the 4D curriculum within the dental school. And the ethos of that is that there's less sort of lecture-based learning, where you sit in a lecture theatre and you're talked to by the lecturer, and you copiously write notes as much as you can, get it all down during the lecture. It's more about interactive teaching. So we have more seminars, we have interactive classes, we have more team-based learning where the students are expected to engage more. Now that's been much more challenging in the last year when the teaching has gone online because of COVID. But I believe we've been really successful in carrying on that ethos, albeit online. Of course, these lectures and these sessions are supplemented by handouts, they're supplemented by PowerPoints, and a lot of these sessions are recorded so that because you're interacting more, you don't get a chance to write everything down that you wanted to, then the lecturers will make sure that there are PowerPoints and handouts that go along with the session so that the students have everything they want when they come out of it. We do have to assess you. We do as much online as we can, and we try to do as much continuous assessment as we can through coursework. So we'll have a blend of online assessments and clinical assessments, coursework and portfolio assessments. Now, as I said, at the moment, you're taught together and assessed together with the dental students in year 1 and year 2 to the same standard. You do all the same teaching and you do all the same assessments, and the pass marks are exactly the same because what you're learning in year 1 and 2 is exactly the same and to the same standard whether you are a dentist or whether you're a dental therapist. As I said, that might change for when you begin in 2022, but certainly it won't change very much at all. From the point of view of content of the programme, it might just change that you're not as integrated for year 2, but there certainly will be a huge degree of integration because we feel it's very successful and the students really enjoy it. Dr. Mason also spoke about student support and how well the students are supported within the dental school, but the university itself is really successful in supporting its students both academically and pastorally. So we've got a picture of the inquiry centre there that is located at Campus Green. I hope one day you'll get to visit Dundee, but you can see the virtual tour later and you'll be able to see Campus Green where we've got the inquiry centre, and if you have any issues at all requiring support as a student in Dundee, there's nothing that they can't help you with or certainly send you in the right direction. So what about admission to the programme? Fiona's already spoken about admission to dentistry, and it's not that different at all to dental therapy from the point of view of the admissions process, but of course the entry requirements are different, and so is the deadline actually. So you apply through UCAS, of course, just as you would for dentistry. The deadline's different for therapy. Your deadline's a little bit later for dental therapy. It's the 26th of January. Entry requirements for the therapy programme for Scottish hires is 3 Bs and an A at hire. If you're a dental nurse and you have a dental nursing qualification, that is reduced to 3 Bs at hire. If it's A levels that you have, what we're looking for are 3 Bs at A level, or if you're a dental nurse, we're looking for 3 Cs at A level. Now these must include higher biology or A level biology, and they must include chemistry at standard grade or National 5 or GCSE. Okay, you must have studied within the last 3 years and you must have achieved your acceptable biology qualification within the last 5 years. The real difference for therapy is that you are not required to do the UCAT test. You are required to attend an interview, just exactly the same as the dental students would be. These multiple mini interviews are exactly the same for therapy as they are for dentistry. Now, your personal statement is not appraised from the point of view of getting you to interview stage. It's just your academic scoring that gets you to the interview, but we absolutely will look at your personal statement for the interview. So it's important from that perspective, as Fiona said. And exactly what Fiona said about work experience in dentistry applies to therapy as well. We totally understand that it's not easy to get experience in a dental practice, shadowing a dentist or a dental therapist at the moment, and it hasn't been recently at all. We're hoping that will get better, but the advice that Fiona gave you absolutely stands for therapy. Speak to a dental therapist, speak to a dentist, get in touch with someone that you know has got experience in the profession, and you just want to make sure that you've asked enough questions and looked at enough about the profession to know whether it's for you or not, because it's not for everyone. And if you were to embark on a programme and realise that clinical dentistry or clinical dental therapy isn't for you, then we want you to have realise that early on. So admission to the programme, as I said, is these MMIs, multiple mini interviews. Now, if you were to do it at the dental school, it would be 10 stations of 7 minutes each, assessing different parts of you as a person. How do you communicate? Are you good in a team? Are you empathic? Are you caring? Do you have a good moral compass? What do you know about the role of a dental therapist? We've had to cut that down to put these multiple mini interviews online, and now that we have confirmation that these interviews are going online, there will be fewer stations that we cover online. As Fiona said, it will be 2 members of staff and a current student that will be involved in the interview, but the interviews last year assessed exactly the same as we would have face-to-face. So don't worry at all that you're disadvantaged at all by it being online. If you're successful in gaining a place, of course, we need to do mandatory health checks. You need to have some vaccinations, and we do a mandatory criminal record search as well, and that is to satisfy the regulatory body, the General Dental Council, for entry into a dental programme. I won't go over the 4D curriculum at all because Dr. Mason did that really comprehensively earlier, but we want you to be lifelong learners, and we start that from day one. We try not to present you with everything you need to learn so that you learn at parrot fashion. We try to encourage you to go away and discover the knowledge for yourself, and these team-based learning sessions that we do with you, you will be given time to go away and work in groups and discover for yourself different aspects of the case that we have spoken about in class. So there's lots of interactive small group work sessions and lots of clinical activities to keep you engaged and interested. There will be some times when we have topics that really can only be taught in a more lecture-based situation, but we certainly, it's not overkill by lecture anymore, and that's a good thing. So any further information that you might want to learn about dental therapy can be accessed through any of these websites. If you want to find out more about the remit of a dental therapist, you can do that by the GDC or any of these dental therapy associations. If you want to get in touch with me, my email's at the end of this presentation, so it's maxine.lee@nhs.scot, or if you have more admissions type queries, it's contact us at dundee.ac.uk. Thanks very much.
Thank you very much, Maxine. That was great. So we were scheduled to have a little 10-minute break, but in the interest of the event finishing on time, I think we might just cut that down to a few minutes. That'll just give time for our next presenter, Gigi, to get set up. So if everyone's happy just to take a couple of minutes, and then we will return with our next presentation on student life and our virtual campus tour. Gigi, are you okay just to share your PowerPoint, please? Perfect, I can see your slides. Oh, and I can see your face now as well, fab. Yeah, we'll just give it a minute and then you can just start your presentation. We'll just give people a chance to, again, have a wee leg stretch and grab a drink or something. So that's been a very quick couple of minutes break, but as I say, I don't want the event to run on too much. So when you're ready, Gigi, if you want to tell us about student life, that would be fab.
Sure thing, thank you. Well, hi everybody and potential applicants to my degree. I'm Gigi, I'm a third year dental student at Dundee, and I'm here to share about how is it like studying dentistry in Dundee.
Oh, Gigi, I think you're on mute. I can't hear you.
Oops. Sorry.
Happens to us all, don't worry.
I'll start again. So hi everyone, I'm Gigi, I'm a third year dental student. And I'm very happy to be here to share with you more about studying dentistry at Dundee. So why did I choose dentistry? Well, there are lots of reasons, particularly because I love working as a team. I like talking to people. And I know that I'm someone who really likes science and likes to do things hands-on. So I went for a lot of job shadowings, from shadowing a lawyer to an urban planner, to a speech therapist and a respiratory therapist and doctors and so on. And I finally decided on dentistry. So I would say that studying dentistry, it's a really significant choice that will impact your life, so don't make it lightly. Go for as many shadowing as opportunity as you can, and to make sure you really like or you really want dentistry to be part of your life, and I think that Dundee would be the happy place for you. So why specifically so? Well, when I applied, Dundee was a really easy choice because Dundee was ranked first for best dental school in the UK, and Dundee till now still tops the whole of UK for student satisfaction. And I think this is very important because what does student satisfaction entails? It means that students here are valued. We are not seen as numbers on an Excel sheet or just, you know, products that of just education that the school just wants us in and out of the door. We are seen as individuals. The school put in a significant amount of effort to develop us as individual dentists, and you are treated like a dentist from the first day of school. So you are expected to be professional, but at the same time you are given a lot of learning opportunities, and more than other schools, I would say, because clinical starts from the first day of school or the first week of school. So you learn everything in a very safe and friendly atmosphere. There's the student to teacher ratio per clinic. As of now, it's 1:4. You really can get all the attention that you need, and I think that helps in learning a lot. And it's also good that the cohort size is relatively smaller, so everyone knows everyone, and it's very easy to actually have a synergistic effect on like starting projects, research, or society. So I think that's what makes Dundee really unique. And another thing is that in the same building, Dundee is also the people who write some of the NICE guidelines and SD stuff. So we have world-renowned teaching staff, and in fact the same staff who are setting guidelines for Scotland. So that's, I think, the plus points of Dundee Dental School. And of course the course itself, which is what Dr. Mason has spoken about. So what I particularly like about the course was the early clinical experience. And I think another plus points for Dundee, which not a lot of universities have, is that in our MSI building, where we have the anatomy lab and we experience cadavers, they are teal cadavers instead of being solidified in formaldehyde. So it means that the bodies are preserved in its most realistic form, so realistic that if I were to, let's say, open the arm of a cadaver and I was to pull a tendon, the rest of the arm will move. And I think that's extremely rare, because for teal cadavers to be available, the school has to put in a significantly higher amount of money to support that. And teal cadavers don't come easy because they need to be soaked completely in teal for a year. So the amount of prep time and money that the school is willing to invest for our education, and particularly in these aspects, I think it goes to show the kind of extra miles that Dundee would go for its students. Another thing that's part of the course that I find really supportive as a student is having personalized mentor meetings, and this is within the dental school and also out of the dental school. So for example, as a dental student, I could speak to a member of staff in a dental school for anything at all, not only schoolwork, not only clinical experience, but also myself as a person, what I have in terms of my goals in life other than being a dentist, and you know, life plans, career plans. I think you really have a lot of chance to receive personal advice, which is, I think, the main point for why you're coming to uni, because you want to be a dentist, but you also want to know where you're going after becoming a dentist. Life is not all about just getting the BDS degree. And then outside of the dental school, different like parts of the whole university or even our union, they offer chances or channels whereby you can also get an external mentor. So my mentor was actually a really senior position somewhere in the NHS, so she was able to shine light for me on how to get on how the leadership positions work, or how the NHS structure works if I want to branch out from dentistry and, let's say, be involved in just on a more regional level. So I think it's really depending on your individual what you like. Same for the intercalated masters that you can do after a second year. It's on your interest. There are people who did research on, I have friends who did research on cleft palates and stuff, and I also have friends who did research on public perception and more UI UX design style. So it's kind of like understanding like human psychology and how certain nudges affects people and affects their oral health outcome. So yeah, this is just a bit part of like the entire course that you will get in Dundee. So as I said, there's a lot of very different teaching methodologies. We have face painting, we have our discovery week that's always very interesting, and I think a lot of people look forward to it. Discovery week, as I think Dr. Mason would have mentioned, you can pick any project that you would like to do, and then on the right hand side is just a really sweet picture that my batch tried to do. It's a tradition that we started. We'll take a picture every year so that we can see when we graduate how we look like as, you know, wee tiny kids, and then when we graduate maybe a bit more wrinkles and grey hair from the studying. But yeah, we didn't take one before the end of second year, I think, because of COVID, but yeah, we'll try to sort something out again. There's many ways to get around this. Yeah, so I will play a video. I'm not sure if you guys can see it. Yes. So this is also one of the ways we learned about nerves, whereby one of my friends, as you can see, is connected to a machine, and then when it sends pulses, she jerked. It's like an involuntary reaction. So this is also just one of the many things that you will expect in the course. And of course, laboratories, not only in the dental technical lab where you practice drilling your cavities and more of like your manual dexterity component of the course, you also go into the microbiology labs in 9 wells when you study about different strains of bacteria, viruses. You see them under a microscope, and it's quite interactive because you can scrape like stuff off your friend's oral cavity and then put it in a petri dish and grow it, and then to see and the different bacteria kind of show like what things they are more susceptible to. And of course in the course we have clinical sessions. I think at the start, most likely when you are working, you'll pair with a classmate, and then you guys can take turn being a dentist and a dental nurse. And I think that it actually improves my learning, because when I'm a dentist, I'm trying to think of the stuff that I have learned in class and apply them to the patient. But when I'm a dental nurse, I am looking at my friend's performance and constantly reflecting on what did she or he did well that I probably would not think of, and what I would have done instead if there are some areas that I think can be improved. So I think that's a really good way, a good system. But as you go up the course, and if you are doing more time sensitive or more like high level procedures, then you'll get like a assigned dental nurse who will help you. And I think that to be very honest, as a dental student, when I'm choosing dental school, of course we will compare which school is better. Of course we will see which, not that I'll get a bang for my buck, but like which school is more worth my time, what can I learn the most, which can I be most prepared at. And I think like Dundee is a really good example. Like probably the teachers here won't try to blow their own trumpet, which I think they could do a lot more. But in the clinics now, like we already have so many pod setups, and pods are areas that are negative pressure that the school have hired to be built so that we can do aerosols generating procedures. And I think like it was set up within like a really, really quick, like maybe less than a month or a month's time when COVID hit and there was restrictions on. And I think this shows that like our school might not be 100% ready at like accommodating everything, because who would have expected COVID to hit? But that shows like our capability in you know just getting through and being innovative in tough times. And I'm sure like you can compare it to any other school in the UK or on Scotland specifically, and you can see, you know, their level of preparedness and what they have done with their students so far. I can only share with you about what it's like to be a Dundee student, but I think it'll be also good if you can talk to students from other university and make the comparison yourself. Yeah, so how has COVID affected us? I think this is very important to actually talk about, because I mean, there was a time whereby clinics were not available for students, but I think that in Dundee we were actually very well taken care of. We have priority for vaccine, and every dental student I know have already had 2 doses since a few months ago or a month ago, and we have our personalized mask fitting. So this is different, whereby different from the surgical mask, you are actually fitted like with a machine and with like chemical agents to test exactly how many particles get into your mask through the filter, and to manage your risk for COVID. And I mean, with the reduced face-to-face teaching, I think there are a lot of benefits. Traditional lectures have moved to online teaching. This means that they are recorded. So if, let's say, I have friends who are working as dental nurses, and I have friends who are also having other jobs to sustain themselves, so they can always work around their schedule and then move things around and catch back on with their traditional lectures, with what would be a traditional lectures that they would have to miss or cause a lot of like additional rescheduling of stuff. There's increase in non-AGP work, means you can't really use your ultrasonic, you have to use hand scaling, and I think although you might find it a bit taxing at the start, it's actually very good extra manual dexterity practice, which would come in very handy when you're doing procedures that require higher level of manual dexterity, I mean, in my later years. And of course, other than the intercalated degree that you can do, there's also something called the intercalated masters that you can do, whereby it's for students who, as of now, who already have a prior degree. So you don't have to take a year out of dentistry. You can actually do both at the same time. So when you graduate, you can have a master's and you can have an undergrad at the same time. I think this is actually really good because you can do more with the same amount of time, provided that you're competent, and it puts you ahead when you are trying to get like a specialty training or a CT training, when you're fighting with your peers for like application and down the road. Yeah, and I think Dundee really embodies what is called new age teaching. It's no longer just a classroom, a boring thing, and whereby like the hierarchical pyramid in the school is really, really steep. So by what I mean, it's like the Dundee is relatively flat. The divide between students and teachers, teachers or lecturers here don't see themselves as someone who is better than us in all aspects, and you know, the very traditional, like, whatever I say goes, you can't question me. Dundee here is very much always like a discussion, and we always try to reach a mutual agreement. This goes all the way to the head and the deans of like the school and everything. Like, everyone is really friendly and they are very keen to hear what students have to say. I think that this is part of the fact that they believe students, even though we are still students, we are treated as adults and professionals, and that our opinion values as much as any other staff. So it's kind of like I think it's a very healthy environment where whatever we think could be improved on, when we give a feedback, it comes right back at us and we benefit from it. The change is really a lot since I have started here, and I think the course is only getting better and better, because after every year of students, there's always improvement made or changes made, and there's always making sure that the course is feeding exactly to what the GDC guidelines are, but also conducted in a way that best fits students in terms of our learning. And it varies from different year. What I think will work for my year might be different from the other year, and the staff is really extremely accommodating for it. So next part about the course, we also used to have outreach before COVID hit, and actually this is a really interesting thing because you can actually apply and go to different areas of the world to learn about dentistry and actually have a shot at them. This is some of my seniors who were at Peru. Access to oral healthcare aren't the same in Dundee or bigger cities, so they have to go by ship in the Amazon River, and they see a lot of different cases that are at varying extents, or things that would not really be seen in a big city like us. But there are also people who I know who really love the Japanese culture and went to Japan to do her elective. So it's really about wherever you can think of, you just have to work it out with the school and then go for your elective, learn as much as you can, and then always be constantly reflecting. So here are some of the highlight and challenges with what I think being a dental student in Dundee entails. I really love the patient contact that we get since first year. I think myself, I would find it extremely hard to have to wait to third year to start to start seeing patients, because it will be 3 years of not doing the things I applied to dental school for. And believe me when I say that when you meet patients more earlier in your dental career, you learn to talk to them. You learn to get more used to talking to them in a professional manner that makes you comfortable and makes them comfortable too. Because I think at the end, dentistry is a service whereby people are really particular about the practices that they go and the dentists that they see. And as dental students, I'm sure everyone wants to be the best that they can. So I think this is the plus points of Dundee Dental School. There are also a lot of dental related events, whether it's from the Wikipedia program, whereby I think Dr. Mason mentioned previously too. It's an international organization thing that has spread across the world in terms of writing good research articles on Wikipedia that make sure that members of the public and also the dental community have access to up-to-date and relevant and accurate information. And then there's also Dental Dreams, whereby it's a research society of our school, and we can offer students paid summer internship program. So by the time you graduate, you can have so many X number of research under your belt, and you are paid to do them over summer. You get a stipend, and I think this is it kind of makes you learn more about a single area of dentistry that you are perhaps more interested to actually explore your understanding of it and to see if you would prefer a specialty in that area. There's also other dental events that are hosted by the Dental Society, more social events where you can just get to let off some steam from the dental school. But the challenges I would say is that dentistry, it's a tough program and it's very demanding. It's like a 40 to 44 hour work week on paper. But I think the biggest difference is that if you are staying in, let's say, halls, student accommodations, and your friends will get the whole of Wednesday off, and you don't, and you can't really make it for a lot of societies that have staff on Wednesday morning or afternoon and stuff. So I think it's really understanding about it's kind of like coming with an expectation that as a dental student, there will be sacrifices that you have to make. And then the rest about time management, I think it's just be good at deciding how time sensitive a task is and how important it is. So I think then this would guide your prioritizing skills, and yeah, then you should be in a good state and don't just always be on the ball of things and don't let things snowball. So this is the other side of dental school. You can see on the top left hand corner there is us celebrating Indian festival, and then it's fun, holy. We wear white t-shirts at the start, and then we celebrate with colored powder, and then we get a nice not tie-dye but a colorful t-shirt at the end. Good memories. There's also like a lot of other like dental balls. And then also for our dental society, we will also team up with another university's dental society and have games sometime, game day, and then have a good night celebration afterwards. And then also sometimes you get invited into conferences, as you can see me on the right hand side. Enjoy some free champagne, that's always good, and then interact with people from the council, Dundee local council, interact with research staff, and also interact with people from like a multidisciplinary areas whereby they can be specialists in different areas, maybe sociology, psychology, business, and you can get to just interact with them, hear what they're doing, and see if you have anything in common that you like to do, and maybe come up with a good project. There's a lot of funds that the university actually offers and competition that you can go to in our university here, and get funding for your idea, and who knows, maybe be a CEO of a thriving business by the time you graduate university. So this is also the other side of the dental school. There's a ball, and then we also have talks frequently. As you can see in the middle, we got the singing dentist to come and share some of his experience and how he got to where he was with students. And then on the left hand side is just Dr. Mason and a bunch of my friends in Singapore. We hosted him when he was visiting. I think the best part of coming to Dundee and being in a course that has a lot of international students is that you kind of don't really have to stay in hotels anymore when you travel. You just have to hit up a friend and say, hey, can I just crash at your place for a few days? And then, I mean, that's your local tour guide settled too for you. So yeah, it's the perks. So I think now I'll move on to why specifically Dundee as a city. If you can't hear from my accent, I'm not from here. I hope you guys can understand what I'm speaking, my accent, or just let me know, I'll talk slower. But I specifically chose Dundee because it's rated top 10 destination in Europe, and was rated, I think, the best city to stay in the whole of UK. And the reason why it was very appealing to me was because that it was actually ranked first for safety in Dundee. And I think for someone who came from Singapore, that's it's not too far, a short maybe 19 hours flight away. And it's the first time I'll be alone from my family. I think that was a very important factor. I didn't want to go out and fear for my life. I didn't want to, you know, walk on the street at night, or if the sun sets a bit early and I have to keep looking over my shadow, my shoulders, and always be on the edge of things. Dundee is actually really, really safe, and that's what drawn to me. It's also a city that's very unique because majority of its populace, more than 50% are university students. So I would say that the university community is very robust, and we have a zero tolerance policy in the union, which makes sure that our well-being, our safety of all students are taken care of, are accommodated and accounted for. So that's the drawing point on why it's safe, and there's a sense of like you'll be well taken care of in Dundee, whether it's in the university or its people here. They are extremely welcoming to students, and it's very common for you to be just sitting on a bus and just talking to a random stranger who'll be interested in the course that you're studying, want to know what's up to and try to keep up with the times. Yeah, and I think Dundee being a smaller city is relatively cheaper too. There are good transports, and rent here, when I compare to my friends down in London, it's actually less than half the price of their rent. Yeah, so it's a developing city. There's a Dundee city plan that is starting, and I think that it will be more robust in the next coming years. And another perks of Dundee is that it's the sunniest city in Scotland. If you love the sun, you like good weather, I think Dundee is probably your best bet. Yeah, so this is some of the stuff I do outside of dental school. I like to go traveling with my friends. As you can see, went to Creole recently to eat a lobster. That was what I wanted to do after the exam. You can be involved in DUSA, the student unions. There are paid positions and also non-paid representative positions, whereby you can allow student voices to be heard. And then below it's me and, if I'm not wrong, Berlin. Me and my friends tend to travel during the Easter or Christmas break that we get, which lasts for 2 weeks or 1 week, depends on your year. It's good to travel, good to see the world. I mean, traveling with friends is always a once-in-a-lifetime experience. And then below you can see me trying to ride a horse for the first time. I mentioned that dentistry is actually really heavily intensive in terms of the workload, but that doesn't mean that when you come to Dundee you only study. There's so many other things that I have done outside of the dental curriculum, and a personal challenge of myself is to actually pick up a new skill every year. So the first year I joined the choir, which I have never done so before. My singing is probably horrible, but you know, if you're singing as a group, it probably hides a lot of your flaws. And the second year I challenged myself to horse riding. That's me riding a horse. I can safely say that I won't fall off a horse now, but I can't really tell you if the horse will move. And then in third year, I'm trying to pick up ice skating. I'm good at skating backwards. I'm still trying to work at skating forward. So that's me and my progress. And I'm also someone who's very involved in leadership. I like to challenge myself. I like to, you know, improve on my public speaking skills. I like to improve on my networking skills. So below is a website that I have it's a blog that I've documented about my journey in second year. It involves a position that I've held and the things that I have done. If you want a more in-depth things of like societies available or what is it like being not typical but being an active student in Dundee, you can look at the website below. And then yeah, just take a look at what other things you can get up to outside of the dental school. So that's all from me. If there's any questions, I'll be really happy to take them.
Thank you very much for that very interesting and insightful and very honest presentation, Gigi. That was great. There might be some questions in the Q&A, but I am going to pass over to Finlay now, who's going to very quickly take us around the campus and do a little bit of a campus tour, and then hopefully we won't keep everyone too late, because I'm aware it's now coming up to past and people probably have other things to do with their day than listen to us. So I'll pass over to Finlay and we can go around the campus.
Thank you very much, Amy. Can I just check, can you see my screen okay?
I can see the map, no bother. Perfect.
So I'm assuming you can see my mouse moving. This is the dental school here, so overview of the campus. This is the dental school here. However, I think we'll probably skip over this for now because you've seen and heard quite a lot about it, and people have probably given a far better description of it today than I can. So let's have a look at the rest of the campus instead. So let's go for everyone's favourite building first, the library. This is where we spend a lot of time. So main library for the university, just about the only one on campus. Is a small one in the art building for art students, but for all intents and purposes, this is all we need to know about. So it's over, you can kind of see here, so over 3 floors, ground floor, first floor, second floor. Let's take a look inside. So this is inside the kind of foyer reception area. We have got library services and IT services, so they're just really good. Certainly IT, they're fantastic for helping out with IT problems, either on your personal device or kind of in the library computers, that sort of thing. Library services, really good for if you don't know how to take out a book or something, speak to them and they can help you. Cafe, so kind of a wee cafe, kind of does your standard, so soup, there's tea, coffee, sandwiches, light lunch sort of stuff. So if you're in here for a whole day, you don't really have to leave, but sometimes that's good, sometimes it's nice to get out, get a change of scenery. And then behind this wall, you've kind of got a seating area, so you can either bring food from the cafe or bring your own packed lunch, sit here, have a lunch and relax. Then if we go inside the actual studying area, there's kind of 3 sections, as it were. There's group study, which we are looking at here. So you can kind of see there's some tables, group work, desktops. It's a bit louder, generally not too loud, but there's kind of discussion going on, conversations about. And we've also got some soundproof study pods in here. So there's, I think, 4 of them: Europe, Asia, Africa, Australasia, and a couple of Americas are over here. They're not soundproof, but they've got some screens. So these study pods, they've got screens. You can kind of come in, practice presentations, do some more group work, that sort of thing. So that's one area. Then we've got silent study or quiet study, which, as its name suggests, it's kind of quiet. There's no speaking really. You can whisper, that's about it. And then silent study, so upstairs, basically above this for 2 floors, and also this kind of bit here and over here, and actually behind here as well, behind the pillar, are all silent studies. So they're absolutely dead quiet inside. You can hear a pin drop. So it's really good if you just need to sit down, crack on, get some work done. So that's the library. Then let's go to some accommodation. So Belmont, we've got 3 sets of accommodation basically on campus. 2 are on campus, and then we've got Seabraze kind of over here, which I actually measured it once, is under 100 meters off campus. So for all intents and purposes, it is on campus. And we've got West Park kind of located between campus and the Nine Wells Hospital. They're generally, or certainly Belmont, Heathfield and Seabraze are basically identical inside. So we shall just have a look at Belmont and you should get a feel for all of them. In Belmont Courtyard, they've all got a wee bike storage here, although to be honest, Dundee is small enough, compact enough that you don't really need a bike. And laundrette, so washing machine, tumble dryer, is it $2.50 a wash and dry, I think, so not too bad. You can take it home to mum and dad. They love to do it. When you move out, they start to miss you a bit and want you to come back so they can do something. Anyway, let's take a look inside. So this is a standard room, the only kind of room there is. Big, spacious, single room, comfy enough bed, big desk for all that studying you should probably be doing but won't actually do. Lots of storage space for all the books you'll buy and not read, or Easter eggs as this person seems to have. So this photo was taken of someone who lived, when someone was actually living in there. It's probably tidier than most student flats, to be honest, but it had to be tidied for the photo, I guess. And then they're all ensuite bathrooms. You don't have to share with anyone, which is brilliant. So you go shower, toilet, sink. So we've got 6 of these rooms per flat with a shared kitchen living area. So unfortunately, Belmont doesn't show you the kitchen living area, but you can have West Park. West Park kitchens are slightly bigger because you're sharing with 8 to 10 people, but style wise it's very similar. So we can just have a wee look around here. Can come obviously built-in stuff, oven, most other stuff you have to bring yourself, so crockery, cutlery, toasters, all of that. They have Facebook groups go up before people arrive, like a month or so before, so you can meet other people in your flat, discuss who brings what, because everyone turns up with a toaster and you don't need 6 toasters. So that's accommodation. Let's have a look at the gym now, ISE. So cheapest gym in the city for students. This is just the wee foyer area. We've got the gym in here, which we shall take a look at in a second. Behind these is a big double games hall, and along this corridor here is another double games hall, so they kind of get just used for everything you use a games hall for, I guess, like in school. So maybe indoor football, badminton, volleyball, all of these things. They have like circuit classes and things as well. Upstairs we've got SPC, Strength and Performance Centre, and a couple of studios. So SPC, it's big Olympic weights, and studios are kind of studio stuff, so dance club use them. There's yoga, these sorts of things go on in there, as well as 3 great squash courts. I don't play squash, but I know a guy who does, and he says they are a fantastic resource. So let's take a look inside the gym. 200 plus bits of equipment in here, covering kind of all your fixed weights, and you've got cardio at the back up here. So elliptical trainers, rowing machines, bikes, all these things. A lot of them have screens on that you can see. These are all linked to the internet, so you can study and train, or watch TV and train, as most people actually do. So this is our sports facilities in this building. We've also got a swimming pool, 25-metre pool, and sauna, which is located in the Union. So this can be booked, or you can go in and swim by yourself, or you go to any of the clubs. There's triathlon use it. Like when I was in the rowing club, so we used it we threw people in to make sure they don't drown. Kayak club use it, so very heavily used. Good to get out. I've got tennis courts, so I've not got the coordination for tennis, but these are also heavily used. Not just by tennis, like during the pandemic, they've had socially distanced exercise classes held on these as well last summer. And lastly, for those of you strange people who enjoy doing sports with others, so field sports, team sports, we have got endless pitches as far as the eye can see down at Riverside, so not quite on campus, but every Wednesday afternoon is sports afternoon, so you get that off, and they put on buses to take everyone down for training and competition. I don't know much about field sports, as you can guess. I probably don't do it, but they've got some AstroTurf pitches, which they are very proud of. I don't quite understand what they are, but they are very proud of them. So that's the gym, and then let's jump into, well, pointed out earlier, someone I can't quite remember who, the inquiry centre. You saw the red outside facade. Let's have a quick look inside. So behind this computer here is a desk, so you can go in, ask them any questions that you've got about uni, or if you're lost on campus or whatever, go and speak to them, and they can generally help you out, or if not, they can find you someone who can. And then I realise we are running over a bit, so I'm going to go to the Union. We'll have a look at the Union and then leave it there, because that is the next or last kind of main thing to see, I think. So Students' Union, this is outside the back or front, which depends which way you want to look at it. It was what, #1 in the UK for 6 years running, I believe. It's certainly up there in kind of the top 2 or 3. So this is the outside. Let's go and have a look inside. It's over 5 floors, so this is the ground floor here, or floor 1 if we use the American system, the wrong system, but that's the system they use in the building. Pavement Cafe, it's just kind of standard cafe, teas, coffees, sandwiches. I think there's cookies and things as well, so not proper meals, but quite nice for a coffee break or whatever mid-study. Then we've got it's nominally a nightclub through here, mono, so it is kind of in the evenings, nighttime, it is a nightclub. But during the day, evening, it's used by lots of societies. So I'm in the Self-Defence Society. We do self-defence in here on Tuesday evenings. I'm also in the Aerial Society, so we sometimes do pole dance or silk dance in there as well. They've got OPSOC, so the pantomime, not pantomime, but kind of show society. They do pantomimes. They put on shows in there. Yeah, lots goes on. Very multi-purpose space. Second floor is just the kind of reception area, and that's also where the swimming pool is. Third floor, for some reason we've not got a picture of it. It is Lyre Bar. We can can't quite see it. It's just kind of through there. So it's kind of during the day, comfy seats, coffee is open as coffee bar. So coffee, once again, cookies, that sort of thing. In the evening, it becomes a bar, and it's got screens up everywhere. So they put on loads of, well, like Game of Thrones, that was on live when that was being shown. They have all the major sporting events. So all the rugby, is it American Super Bowl? I can't remember, is that football or baseball or something, but whatever that is, they have that on in there as well. Onto the 4th floor, we have got food on 4, which is kind of American style diner, burger, chips. It's maybe not the healthiest, but it's quick, easy, quite good if you've just got half an hour between lectures or whatever. Over here, we've got the Hive. That's where the DUSA exec are based, so they kind of help manage a lot of the student side of things. If you've got problems with your course or whatever, you can speak to them. Their desk is open, I think 10 till 3 every day, so you can go in and speak to them. And like the inquiry centre, if they can't help you, they can find you someone who can. Then actually, while we're here, I'll quickly point out above Lyre, so on the 5th floor, we've got floor 5, which is once again another nightclub in the nights and evenings. During the day, it's quite nice, a very quiet study space, and once again used by lots of societies. So yogaing up there. I did salsa dance for a year. We danced up there, so very multi-purpose. And jump into air. So Lyre bar, which I talked about earlier, does look very similar to this inside. It's just bigger. So air bar during the day, once again, as with the rest of this place, really chilled out, nice and comfy chairs. You can come have a relax or have kind of study in a more relaxed environment. It can be quite dangerous though. I came here for a 15-minute study break once and left 8 hours later. But yeah, so that's during the day. In the evenings, it is a bar, but it's kind of a lot more chilled out and quiet, so you can have a conversation in here. They have pub quizzes, karaoke, that sort of thing. So I think that's everything major really for dentistry, at least on campus. So unless anyone's got any questions, I shall hand you over to Amy, and I think that's the end of the session.
Thank you for that whirlwind tour, Finlay. Yeah, that's everything from us today, folks. Thank you very much for those of you who have joined us. I hope the session has been informative and useful to you all. If you have any questions, you can get in touch with either Fiona or you can email contact us at dundee.ac.uk and we'll be able to help you out. We will be about for a few more minutes, so if you have any last minute questions to put into the Q&A, feel free to do that as well. Yeah, thank you very much for joining us, and I hope you all enjoy the rest of your day. And we hope to see you in Dundee soon.